Dr. Natalia Kanem is the United Nations Under-Secretary General and the Executive Director of the United Nations Population Fund. She was in Bhutan on an official visit upon the invitation of the government of Bhutan. I caught up with her during her recent visit. Dr. Natalia, a very warm welcome to Bhutan. This is your first visit to Bhutan. What brings you here?
I'm delighted to be here in this legendary country. I'm here, and it is an honor for me to meet with government and with civil society organizations and students in my capacity as the Executive Director of UNFPA. It's the United Nations Sexual and Reproductive Health Agency, and we have a lot to show for the partnership with Bhutan for most of the 50 years that we've been in existence. I'm very happy to be here.
This being your first visit, how did you find the place and the people here?
I feel very fortunate because UNFPA works very closely with government, and under the leadership of His Majesty, the themes that are important to the people of Bhutan go to the very heart of what UNFPA works on. We are part of a United Nations system, and it says that we should not leave anyone behind. So for my first day here, I learned a lot about the tradition and the legacy and the importance of Mother Nature to this country. My very first stop was to experience for myself the meaning of the tiger's nest. I didn't walk all the way to the top, but I went to the base camp. And my team has prepared over the course of the past year to highlight in our 50th anniversary year the achievements for the women and girls of this country. So by going to Tiger's Nest and seeing how the respect for the cycle of life is fundamental to what's going on in the country, it gave me a context to understand the achievements of improving the death rate during childbirth, for example. It's gone way down in Bhutan. I also understood how the commitment to climb the mountain, to cross the river, whatever it is that we have to do to help a young girl who needs the services of UNFPA, the Ministry of Health, the education system that we work with, how important it is to understand the local context. I am very, very interested as a pediatrician myself in the well-being of young people. So coming to Bhutan is personally important for me. This is the only country in the world that very early on said, let us think about happiness as a measure of human development. I believe that this is a wonderful example and that I will have the opportunity to learn from my Bhutanese colleagues, from the rest of the United Nations system, and from the government and people. How do we make this reality here in this country, but also in so many other places in the world?
The United Nations Population Fund has been there in Bhutan for longest time. What does the UNFPA do in Bhutan in general?
Well, you know, we've been here for 45 years, and there's been a lot of progress in that time. UNFPA works under the umbrella of the government. So to have enlightened leadership, to have a succession of kings who have prioritized health and included reproductive health, maternal health in the aspirations of the country, means that we are working in partnership in the communities spread all across the country. So our mission in Bhutan, like it is everywhere else, is to ensure that by the end of 2030, when the Sustainable Development Goals will be achieved, first of all, that the choice of women to decide on their family size will be fully respected and achieved. And we've come a long way here, and it's incredible how the availability of contraception, the availability of counseling, and helping couples to achieve their desires in terms of contraception has gone very well. Under the aegis, again, of the government system, part of the national happiness is also making sure that childbirth is safe. Our second zero is to make sure that no preventable death occurs during pregnancy, during childbirth, and we're even very attentive to the newborn baby as well. This has been a dramatic improvement in Bhutan, whereas just 25 years ago, you had 5 times the amount of women dying in childbirth. Now it's getting to be less and less the case. We're concerned about young women who may be getting pregnant too soon, getting married too soon, and so we're working with government to see how we can achieve the goals that have been set there. And then the third thing that we're doing in Bhutan, and we do everywhere in the world, is to pay attention to what women and girls are telling us. In many countries, and Bhutan is also no exception, it's very hard to talk about violence. It's hard to talk about abuse of women. Sometimes women are very shy to say what's going on in the family. And if it has to do with sex and sexuality, it even gets worse. So we've been working very sensitively through government, through our partners, with young people themselves, to understand the problem, to work with the police, for example, so that they are very welcoming and understand what to do if there's a danger to a woman or a girl. We've also worked very well with the religious community, which is so compassionate in this country, and who have said that, yes, we want for there to be peace in the home and the family, and the protection of women and girls is part of that. So we've been very busy in Bhutan. We have very skilled colleagues who are experts on the collection of data and demography, the study of how population changes. And we have been able to coordinate very well with, for example, the National Statistics Office here in Bhutan. Our goal is to make sure that we can describe what's happening and that we can also help government, which has huge expectations on being able to improve the quality of life for every citizen of Bhutan. We have to help to track the results. So in order to track the results, you need good data, you need data at your fingertips. We can't wait 2 years to know what happened yesterday. So it's a big challenge that we're working with other parts of the UN and other regional groups to be sure that there's evidence and that it's broken down into smaller pieces. If I say that on average, everything is fine, well, the average means maybe some people are doing very, very well, and then there's a small percentage that are doing terrible. So when you break down the data, this is something that we were just speaking with Minister of Health about, then you learn so much more about how we can improve systems. This is one of the goals that UNFPA has for our work in Bhutan.
Why is sexual and reproductive health important globally?
Sexual and reproductive health is an expression of the longing for a cycle of life where you have the happiness of a new baby and the mother should not die while giving birth. It's also an expression for the respect of the body, bodily integrity, and our understanding of how human security, your sense of who you are as a person, has many, many dimensions. And sexual and reproductive health is part of that. As one example, if a young girl does not know about sexual and reproductive health and she gets pregnant too soon, sometimes it is not by her choice. This is an offense against the human rights of that girl. There are other times where through ignorance, she may be married very young and she may start childbearing very young. This is a danger to physical health, but it's also a danger to her ability to fulfill her potential. Who knows what she would have been able to do if she had been able to delay childbirth until the appropriate time that's right for her. it's also a danger to the next generation. UNFPA has made very clear evidence based on statistics. If the mother is poor, if she is young, if she does not have a good education, the next generation, very high likelihood, will follow in that path of being young, uneducated, and affected by poverty. In this particular era, when we talk about sustainable development, we're also talking about the cycle of life of the planet itself. Bhutan, for example, very early on, and this was the wisdom of your royal system, decided that the environment is very important and that it's part of the legacy of the country to look after your mountain, to look after your land, to look after the water. This is part of the cycle of life because women and girls are the ones who are first and most affected by disasters, flood, landslide, earthquake, you name it. And sexual and reproductive health is often ignored during crises. UNFPA is trying to make it easier for people to talk about these systems very respectfully, but many are biological systems, for example, menstruation. Menstruation can be taboo, and it's not easy sometimes to talk about it, but we have to know that it's part of the good health of a woman to understand the menstrual period and how to take care of herself during that time. So we've been working with communities to make some of this knowledge available. I also like to always say that sexual and reproductive health is very important to men as well. It's important to everybody, no matter who you are, to have an understanding of how your body and your life work and what to expect and how to protect yourself from infections, but also from the mental stress when things are not going well in your sexual and reproductive health life. It should be a source of pleasure and happiness, not a source of danger and disease. So by educating ourselves and by making it easier for young people to have these discussions with their parents, with the monks and the nuns that they turn to for advice, and with each other in the health system, we can actually make things a lot better for the population.
Although there has been no official reports on marital rape in Bhutan, we can't deny that there are no cases. There are few cases. So what are your views on marital rape? Is it important for a country like Bhutan to have an act to prevent marital rapes?
UNFPA is very emphatic about the fact that any type of sexual violence or violence in general is wrong. It is against the principle of human dignity and bodily integrity. And that type of sexual violence is also extremely mentally damaging. There are psychological consequences to being coerced to do something against your will. So we stand very firmly from the perspective that she decides. And we have a She Decides champion in Bhutan, who is a young person born in 1994, and saying that anyone, it doesn't matter who you are or where you are or your marital status, has the right to say no at any point in time. So this is something that's very clear. It's also part and parcel of the aspirations of the human rights approach that you're using across the spectrum of looking at the dimensions of women and children and their needs in Bhutan. Very often, as I said earlier, it is not going to be easy for any woman to come forward and say what is happening. It's up to us to open the door and give the safety of knowing that if you come and tell me confidentially that you need help, that I'm going to take this seriously and I'm going to act on what you've told me. I'm going to hold your hand and make sure that you're secure because you feel afraid when this happens. So the skill of UNFPA, of our partners, we work together with many other agencies in doing this, is understanding what is the comfort zone for women to discuss these issues in Bhutan, but also to see men as allies in interrupting this terrible behavior that occurs in every country, and where the only way to change this is to help young people to grow up understanding full respect for everyone, and certainly gender equality is a big part of that.
And Bhutan, there has been a recent tragedy, rape of a child, a school child in Paru, you must be aware. So there had been a few more cases, especially cases of child abuses in Bhutan. So as the executive director of UNFPA, what would be your advice for the agencies here and the general public?
These are crimes when such terrible acts occur that have to be taken very seriously and dealt with very expeditiously. And in conversation with colleagues from UNICEF today, I was made aware of this, but I believe that this is a behavior that's prevalent everywhere in the world. Bhutan is no exception. So as UNFPA approaches gender-based violence, and we will be discussing this around the world very prominently in the years to come, we stand on the principle of full human rights. And a child has dignity. A child is fully human. A child is not there to be exploited. A child is there to be protected and nurtured and loved. So we are working very closely with government, which expresses its concern about wanting to safeguard the beautiful children of these communities, to know that they are going to be protected, to know that steps will be taken to safeguard them. Now, the symptom of violence against a woman or a child has deep roots in so many instances, in mistaken impressions that have been handed down. And so it's so important to have the support of many, many pillars of society. The UN works in partnership with government and with society. So the clarity in Bhutan that this is something that must be changed is very, very helpful, because there's no disagreement there. With the religious community, of course, they are supportive and compassionate on these issues. So it means we must redouble efforts to educate and to penetrate every village, every society, every town, every urban center, and make it very clear that this is behavior that will not be tolerated, and to also help to respond to children who have been victimized with the appropriate care and counseling. It's a priority for peace, in fact, for human beings to interact with each other in a way that fosters harmony rather than as an attack of one person against another. So we feel very sad that in every country in the world, this is a task that we're going to have to join hands to overcome. I personally feel that change can happen, and my anxiety is for it to happen very quickly, not to wait for 10 years or 20 years. So this is something that has priority attention.
The Nairobi Summit on ICPD 25, International Conference on Population and Development, is less than a month away.
Yes, it is.
So what does it mean for Bhutan?
Yeah, it's coming up so quickly. I think for Bhutan, it's going to be an opportunity to really showcase to the world what progress you've been able to make in this society. We're very excited that the Queen Mother has agreed to lead the delegation, and also the Minister of Health, who is very respected in terms of world public health. She's also planning to be in Nairobi for a conversation, which is a global discussion, on the issues of how do we think about universal health coverage and bringing primary health care to everyone. How do we think about data and using it to improve lives? How are we going to pay for this? All of this is the discussion that we'll be having next month. And for Bhutan to be able to give examples of how in a mountainous community you can use mobile technology for remote diagnosis and treatment. This is going to be very interesting. How is Bhutan helping indigenous people, very important nomadic populations, to enjoy good health and to be able to prosper? One thing that I think will be very interesting for Bhutan, your population is healthy and is aging, so you're able to go into healthy old age. This is a concern more and more around the world. We have the most young people ever, and we also have the most elderly people ever in human history. So we'll be talking about strategies to make sure that older people can enjoy life as well as they age.
UNFPA have iconic goodwill ambassadors. Our Queen Mother is one of the goodwill ambassadors, along with the Crown Princess Mary of Denmark and the Hollywood actress Ashley Judd, among others. These are all women who are tremendously inspirational, especially for young women and children. Your comments on this?
Well, UNFPA is very fortunate and very privileged to have someone, as you say, so inspirational, not just in Bhutan, but around the world, as a symbol of how solidarity and compassion and understanding can come even from someone like Her Majesty. And she has pioneered in this country having a lot of initiative to go and walk and to see and to meet and to understand the issues that are very dear to women and girls. So she's a symbol for Bhutan, but also for all of us in UNFPA, as to how fortunate we can be when we join hands and work together. We're very, very grateful for this, and I think it's going to be a very special moment also for the women and girls of Africa, of Asia, of Latin America, to actually see her and to hear what she will have to say on that occasion. And as you've mentioned, we also have other special guests and VVIPs who will be carrying the message of full dignity and equality for women and girls, along with Her Majesty. The opportunity that we have is to inspire another generation of young people to go forth and in the next generation to actually make life better and more equal. So we're very proud in UNFPA that we work with groups like YPeer, for example, groups of young people who are already very passionate, very committed, very able to network. And you know, this is a generation that's connected. So some of the young people of Bhutan have been preparing to play their role in Nairobi, where they will show their leadership on the world stage. It's very inspirational for a time when the world really needs the message of world peace, the message of women who can lead and who can also portray these very inspirational qualities.
Tell us about you. Tell us about your journey. As a young girl, did you ever think that one day you'll become the executive director of UNFPA?
Well, no, I never had any idea that I would be working in the United Nations, far less to be given the great privilege and responsibility of leading what is one of the most committed, hardworking, smart teams you can find anywhere in the world. So I think as a young girl, maybe I imagined that I would become a doctor, and that was a big step. I come from a small country myself, Panama, and when you're growing up in Central America, it's an opportunity to see how many cultures can come together. In Panama, for example, our population is very mixed. We've had waves of immigration from the days of the original indigenous Amerindian population, Africans, Chinese, other parts of Asia, parts of the Arabic world, Europe, we're all there together. And so I believe that that's had an influence on me in terms of being very curious about culture, and I'm a lover of art. So coming to Bhutan and seeing some of the extraordinary artistic legacy that you have in this country, I mean, it's just mind-blowing. It's beautiful. As part of my journey, though, my father died when I was very young, although this extended family network that we have in Latin America was protective for me. It did mean that I left home and went to live with relatives. So I believe that it's given me a sense of understanding of what it's like to not feel like you fit in and to have to stretch yourself to be able to put yourself in someone else's shoes is actually not that hard for me. I can imagine, even though I don't have that exact problem, I'm not living with an overt disability. I may not be blind or something like that, but I can relate to the experience of someone who feels different or needs extra care in order to be able to succeed. I think I've been very fortunate because I was able to have an almost free education. This is something which Bhutan has also emphasized, and it's remarkable that education is free, and I'm told that soon, even into secondary education. It's one of the ways that young people can fulfill their potential. And I think in my life, it certainly was extremely lucky that I was able to have that boost early in life. I always thank my teachers. I remember them, and I try to do some of that myself in terms of mentoring young people and trying to be helpful to them. Although it's a very busy life working for the United Nations and traveling as much as I do, I do try to pay back in that way.
Who were men and women who had inspired you in some ways?
Well, growing up, I had immediate people who were role models for me. My grandmother in particular. She was a cook in the home of a rich family, and she was extremely caring and concerned about them, as well as her community in Panama. She was very active in her church, and she did many things to assist the neighbors. She also was someone who was full of life and told a lot of jokes and had a very friendly personality, so people would come and tell her their troubles and what was happening. And so we always had an impression of our grandmother as a matriarch. So I found it interesting that women also play a respected role in terms of being a confidant in your society. I've also, over the years, been able to meet very extraordinary human beings who, for example, I got to meet Nelson Mandela and to work very closely with him on forming the hospital that has his name. He founded a children's hospital in South Africa. I think I've been inspired by people who have the courage to act, even though it can be very difficult sometimes to stick your neck out and take an unpopular position.
A lot of young girls and women must look up to you. So do you have a message for girls and women in Bhutan?
For the girls and women of Bhutan, my sincere wish is for girls and women everywhere. And that is that I want everyone who meets a woman or a girl in this country to appreciate her for who she is and to respect her wishes and desires. To prioritize her as a human being means that she's going to be happy, her family is going to be happy, her community is going to be happy, and really eventually the world. So my wish is for full respect for women and girls. I would like for the goals of UNFPA, that every pregnancy be wanted and every childbirth be safe, to apply to everyone, whether you live in a small town or you're in an urban center, it doesn't matter. You should have this kind of access. And certainly I think that for the potential of young people to be fulfilled, all of us are going to have to pay attention to the meaning of world peace. I'm happy to be in a place where many of the prayers are for peace. Peace is a dimension that's individual. You have to feel peaceful in your own sense of being. But it is also a platform for the United Nations to emphasize there will be no sustainable development if conflict, if abuse of women and girls, if young children are not respected and brought up carefully. So I think, in a nutshell, my wish indeed is for health and happiness for every woman and girl in the country.
Dr. Natalia, thank you very much for your
Thank
time
you
and
too.
sharing
It's been a
your
pleasure.
insight with us. It was really inspiring.
Thank you. Thank
And
you
we
very
hope you
much.
have a wonderful stay here in Bhutan.
Thank you.
Thank you.